Hi, everybody. You are very welcome to the next episode of the Tracy Donegan podcast. And I am again delighted to welcome back Ruth Phypers, who is based in the UK and has been at this whole red light therapy and fertility lark for quite a while. So she is quite sought out in this field for her expertise, and because I think she has more experience and training in this area than really anyone else on the planet. So I'm very appreciative of you giving me some of your time today, Ruth. And I'm dying to jump into this new paper, but before we do, tell us a little bit about your background and how you found yourself in this line of work.
I know, it's so interesting when you were saying that. I was like, gosh, that like really has happened. I have a natural health background. I came into photobiomodulation, low-level laser, red light therapy. We always say the three things together because the terms have changed over the years. Well, they've kind of changed, but they've not changed. So we always end up saying all three terms. But about 11 years ago, I found it, stumbled across it quite accidentally. Yoga teacher background, along with many other things, technology as well. And I just thought, what is this amazing thing that is completely safe, as long as you don't shine it in somebody's eyes, and really effective, and nobody knows about it. I was like, I don't get it. I don't understand it. It was this kind of quite left field acupuncturist, very, he was old in his years. I mean, he had 5 years left to live at this time. And so anyway, he agreed to train me, and he trained me over a period of 5 years before he passed away. And it's just, it's just the most amazing thing, really. And I've watched things evolve and change over the last 10 years to the point where now I feel like people have got it. Like there's lots of therapists that have got what this is about. There's lots of scientists and medics in the field who are testing this out, not only in the laboratory, but also in the clinic. And we've just got this growing body of clinical evidence now to show how effective this light can be at healing and energizing and improving health. And even then, I think the scientists would still even say they're still not entirely sure what the mechanism is between the light being absorbed into the tissue and then this profound effect that the light appears to have. And we can only say it appears to have, we kind of know it does, but they're still struggling a little bit as to what the exact mechanism is. But yeah, I mean, it is quite an extraordinary thing. By the way, I just want to say congratulations on your book. One of my patients walked off with it today, so I said she could borrow it for a week. So it's very good. I haven't had a chance to study it, but I read it, and I just love the way you've explained this. And there's some very, very good takeaways in there in terms of how this light actually is absorbed by certain elements of the tissue, and then the kind of chain of events that happens as a result of that.
Thanks, Ruth. And I wanted to include in the book information about just light in general, because I don't think enough, especially women who are dealing with fertility challenges, I don't think they really have gotten to grip with the harms of artificial light. So I talk a bit about sunlight and the benefits. There's just so many benefits of getting that sunlight. And then the targeted light, of course, then is just, as you've seen in your own research, fantastic. And then understanding that what I call junk light, that, LED lights at nighttime sitting on your device, all can impact our fertility. So I think people are starting to get that message, but I wanted to make sure I included that, and it wasn't just about the science of the targeted therapy, but a broader kind of overview of light in general and how it affects biology. But I've now, of course, now that your study is out, I'm going to have a couple of updates I already want to add to the book. So it's going to be a work in progress. I think every time there's something really good that comes out there, I'm like, I really want women to get an understanding of this. I'll be updating it. So it's It's good to have that
Good.
that flexibility. But let's jump into your latest article. So it is called Photobiomodulation in Complex Female Infertility Profile, case study with a 12-month follow-up and review of current mechanism in reproductive photomedicine. And in the meantime, if my dog keeps barking, I'm going to have to go strangle him. I'm gonna have to put him at the back and just shut up. So tell me a little bit about, you
Yeah.
intentionally chose a complex case.
Yeah.
So tell me a little bit about why you chose. So this young woman, I think she was 27, had
27 when she came to me. And so she
yeah,
came with a 6 year infertility profile by the time she made it to me. And I actually was working with her. I mean, the thing about the low-level laser for fertility was that it was becoming known for working with women of a mature age. Women over the age of 35, the Ashiro trials, studies that were done in Japan, they started really looking at women with a kind of aging fertility profile. And then the work that came out of Denmark and Sweden was the same. So it was generally regarded that this was good for aging tissue, basically,
yeah,
and eggs as they were getting older. But this woman came along at about the same time, and my first paper actually details 3 case studies of women who were about the same kind of age, the same kind of profile. They had no underlying reproductive health issues. It was basically non-specified age-related infertility. So I always wanted to write about this case, and it didn't seem to fit in with the other paper. So let me do a paper on its own. And it was like opening up a whole kind of like Pandora's box, because I obviously had to study the background of PCOS and endometriosis before I could really write about it. And the first shocking thing was there's very, very little studied about endometriosis. I found it very, very difficult to find much clinical studies out there. And then also what seemed to come to what I realized was that there's still kind of a lot of question marks over the condition. Why some women suffer so much with it, why some women don't. And then in this particular case, to have PCOS as well, which is not uncommon. And I refer to a study that was done in Western Australia, very, very large study. And what they did was they did a whole linking exercise with hospital data and health data in a particular area over a long time. I think it was a 10, 20 year kind of like analysis of data. And what they found was that the women who'd come in with PCOS also were more likely to have a lot of other different health conditions as they aged, and were more likely to have endometriosis than women who didn't have PCOS. And this study actually, it stands quite on its own. And when we were going through peer review on the paper, there was a kind of comment about, oh, someone can't have PCOS and endometriosis at the same time because that's contradictory. They're contradictory conditions. And I was like, they do. And then when I found this study, I was like, but they really do. Like it's a fact. Some really other quite serious health conditions that a woman who has PCOS is more likely to have, from hypertension and, like life-threatening conditions. So the more I studied about these underlying conditions, which had clearly impacted her ovarian reserve, so there was also this diminished ovarian reserve that was in the picture as well. It was a really good thing to do, to devote an entire paper to this, because I just don't think there's been enough written about it generally. And then to be able to link it to low-level laser was really enlightening, because the potential for photobiomodulation in this kind of scenario, there isn't anything else really medically that can address it in the same way that PBM can. So it's quite a bold statement, but there isn't. And that really got me fired up as I was kind of looking at this. And I hope that, the paper doesn't just become like another paper that kind of gets buried in the kind of like masses of brilliant clinical research that's coming out at the moment. Because I do feel that there is a different way to address these conditions. So yeah, that was the background.
So when and you in your paper you weren't just using one wavelength. So this is a multi-wavelength approach. So why did you take that approach rather than some of the other tools that are out there that are a canopy and it's kind of two
Yeah,
wavelengths. So
yeah,
how did you, I guess, decide on because it is
yeah,
experimental when we're kind of at this point. It's like
yeah,
we
yeah,
understand some of the mechanisms. We understand that PCOS is sort of linked as all to blood sugars as well, and there's
yeah,
yeah, both of them
yeah,
together are a huge issue. Um,
yes,
but do you think that this, I guess, a more tailored approach to, especially with something as complex as this, is warranted when we look at PBM? Because
yeah,
there is, I think,
yeah,
sometimes a one size fits all approach that if we just put this wavelength on somebody, we're going to fix everything.
yeah, yeah, yeah. It's interesting because you started off talking about sunlight, and obviously all light comes from the sun. And we all know how much better we feel when we spend some time in the sun as opposed to not. And we're about to go into our dark season now. It's just happened. We've changed the clocks. Our daylight hours are going to be down to, I don't know, between 9 a.m. and 4 p.m. soon. And there's a very, very small window of opportunity, kind of around midday, really, where I'm going to be so strict with myself this year that I absolutely force myself to go and walk around that block for half an hour and just get some sunlight. And it's a very good book called Daylight Robbery. He also talks in that about how important sunshine is for fertility. And yeah, it's widely known that sunlight can really, really aid health. So what we're doing is we're kind of taking the most healing rays of the sun, which are these kind of infrared, near infrared wavelengths around about the 600 to the 1000, 1100 nm band of visible and near and invisible light. And the red is visible, which obviously we see in the rainbow. And then there's these near infrared rays as well, which are actually, even more healing in the case of fertility. And the argument is that, well, you're probably more likely to get pregnant if you can go and absorb sunlight for an hour at sunrise and an hour at sunset, because that's when there's the greatest intensity, and it's mostly UV at midday. But basically, if we work on that basis, what we're doing with PBM is we're taking those most healing wavelengths, the ones that have this kind of optimal healing ability and this ability to be absorbed by certain elements within our tissue. And the 600 wavelengths, the red wavelengths, they tend to be absorbed more by melanin, which is in the skin. And then the 800 wavelengths tend to be absorbed more by hemoglobin, which is obviously, it gets absorbed by the blood flows. So there's a kind of systemic flow through that. And then the ones above that 900 up, they tend to be absorbed more by water. And obviously we're 60% water, 70% if we're really good and we're still young. And so you really want a multi-wavelength approach so that you can target as much of our tissue as possible. Now, you could argue with fertility, why even bother with a 600 wavelength? Because our skin isn't really going to it's not going to have that much difference. But 600 is really good for skin. And it surprised me in the end because, like 10 years ago, I knew I've only used this on my face. I could probably do with something a bit more radical now because I'm kind of like pushing 60 or whatever. But it's like it always surprised me because the aesthetics beauty industry was very, very slow on the uptake, but now they're almost like the biggest drivers of this. So suddenly, you know, and it has actually been called red light therapy, really, because the beauty industry has gone, yeah, this is really good for skin. Absolutely, it's really, really good for skin, and it's so good to see like this really natural, kind of safe, you know, use of red light for skin. But it's kind of confusing the therapeutic use, the medical kind of use, the way in which we can address medical conditions, because really those are invisible wavelengths. So I've been very fortunate to get a fantastic device. I should have it over, it's plugged in over there. It's a home use device made by Hue Light in Korea. And it's this fantastic pad that fits over the entire abdomen. And the first time I plugged it in, I thought it wasn't working because, of course, they've only bothered to put in the 800, the 800 and the 900 wavelengths because they want it to have deep penetration. They want it to really help with digestion. They want it to really help with any kind of reproductive health issue. And so it doesn't even look like it's on. You have to put it on in a dark room to see the glow of the near infrared light. So working with multi-wavelengths, you really want as many different wavelengths within this optimal window to be absorbed by as much different tissue as possible, but mostly I would say by blood and water, to get this deep penetration into the tissue. And we're not just aiming for the ovaries, we're aiming for everything that's going on within the reproductive system. So for something like endometriosis, which just spreads and grows to the point where women may need to even have like other vital organs removed, like kidneys, parts of the digestive tract, because it can be quite rampant in terms of where it grows. So therefore, we need a device that's going to have lots of different wavelengths in it, that is going to have the kind of power that is going to really give a dose that is going to be effective. Yeah. Obviously, we're working in a clinical environment. We can't expect people to be here all day. So you don't want to use something that's going to, you need something that's going to be really focused. And we can chat about that later because I know you and I really aligned on that. And then you want something that's going to pulse at different pulse rates as well, because combined, that's going to really target the most amount of tissue possible in the system.
And interesting with that, especially with endometriosis, and again, it's one of these things that more the women that I'm working with didn't realize at the time. So they've been dealing with specifically endo, and they didn't have PCOS, but I am seeing, like, I'm like, have you checked your, some of them now are wearing the blood glucose monitor just to kind of, let's just monitor what's going on there. But they're, eventually, because it takes so long sometimes to get a diagnosis for this and get treated, that they find somebody, a really skilled surgeon, because that's a problem in itself here in the US, finding a skilled surgeon that can do the surgery. But then so when you have that surgery, you're increasing the chances and you're going to have adhesions growing. So it's like, even if you haven't heard of red light therapy before for helping with endometriosis, that if you've just had that surgery or are planning that surgery anytime soon, get yourself some red light therapy for after to stop those adhesions from growing. I think it's something around 50% of women have adhesions from the surgery that they think is going to help them, which is...
So you have this kind of endometriosis is kind of like choking the tissue. So you need it to be removed. And then there's a whole heap of issues with that surgery, which will then obviously lead to scar tissue. And I've seen just the most amazing things with scar tissue over the years. So people have come to me with scar tissue, I don't know, in all sorts of places for all sorts of different reasons. Fell over in a nightclub 10 years ago and have always had this big lump of scar tissue in there. And we literally, like, this is a really non-invasive procedure. This doesn't involve surgical lasers that are going to be trying to remove the scar tissue. You're going transdermally and it just kind of dissolves. It just goes away. It really does. And then I've seen this visibly, like somebody came and he'd been injured in the street like 20 years ago, and he had this awful kind of like lump here, and it kind of disfigured him. And of course, nobody would go anywhere near this with any other type of laser because it's too close to the eye. It was literally here. And 2 or 3 sessions, the scar has gone. The scar has gone. He's a 40-odd-year-old man. There's no other reason for this. And women have often said, they've maybe had, they've always felt a bit tight after this surgery in the kind of pelvic area. And even after the first session, they've said, completely freed up. I can feel that extra mobility that has never really come back. Working on C-section scars, you see those dissolve away. Even a year after, they can flare up. As I'm sure within months of the actual original wound. And again, I've seen them just calm down, heal, and go to almost just like a white line over a few sessions. So
and that is such an area of concern for women with with the cesarean. And and I know you are as well, a proponent of, we need to get if somebody's watching this and they're thinking, oh, I have this scar, I've had it for a few years, it really bothers me. I would say we can help. But I'd also say if someone knows they're going to have a cesarean, if we can get light on that wound as soon as possible, it'll speed up the healing. The tissues just remodel in a different way. It's just it's lovely, lovely to watch, and it helps with pain as well. I had a case recently where a mom had a planned cesarean. A cesarean itself went wonderfully. Everything went great. But she was now about 6 months postpartum and just didn't like the look of it. But she was also anorgasmic. She couldn't have an orgasm. Now, nobody's having an orgasm the first few weeks after cesarean anyway, but 6 months on, she was like, it's
gone.
The desire is there, but I just, something's going on. And she didn't realize that sometimes with the surgery, it can affect those nerves. So I'm like, okay, we know that the PBM can help grow nerve tissue. So we've seen it in the research, there's nothing specifically on cesarean and nerve regrowth, and a couple of sessions and she started to, to
work.
feel that again. And I'm like,
great.
Just, I always say, I have not found a condition or an issue that it hasn't been helpful for yet. I'm sure, well, maybe there won't be, but I'm just like,
I think some very complex chronic pain issues, that maybe have come from some kind of like injury or nerve damage, chronic, with over, sometimes I think it can be quite, frustrating that it doesn't touch those situations. It can do, but not in all cases. And I think that'll always be the holy grail for us to understand as therapists is, those, why doesn't it work for everybody? Because you see such great results with so many people, but for some people it just...
because it is interesting, because sometimes I'll have someone come in with musculoskeletal and say shoulder issue, and sometimes it's one session and it's 10 minutes. And I'm like, okay, and then almost saying, well, is there anywhere else that you want, while you're here,
how's your digestion?
Let's throw some light on some other things, as well. And but then, and for those people who get that almost immediate result, they're just amazed. And then if you're working with someone that has a chronic issue, that it's been an old injury for years, I think you need consistent use of the laser, and you need it over a longer period of time. And I think people they're not seeing that quick improvement. So they're even doing anything, and it's expensive for a lot of people as well to keep that going for an extended period of time. But tell me a little bit about where you're using your laser on the body. So when you're treating somebody and tell me a little bit about kind of laser you're using.
There's a kind of number of different devices. I started with a very classic 3B device with one probe of a very pure coherent laser, a 3B laser, obviously cold, no heat in that at all. and then a cluster of different wavelengths, you know, this multi-cluster. That was how I started. Great device, classic kind of application. But when your clinic starts to get really busy, you probably need something that's going to deliver a bit more light in a bit of a shorter period of time. Now, that would be contentious within the industry, because there is a line of thought to say, well, the tissue is like a sponge. If you just throw a bucket of water at it, it's not going to absorb it properly. It's going to kind of bounce off. It needs this kind of drip, drip, drip. So I think there is a happy medium in that. You're kind of wanting to get the best dose, the highest dose you can, without it being too much. So I do have a class 4 device, which I was highly skeptical of taking. But then when somebody came to demonstrate it to me, and I'd had a slip disc, which was pretty much there, but it wasn't quite there. And, you know, my class 3B had kind of got it so far, and I had one session. He said, well, let me just show you. And that was it. It was resolved. And I thought, oh, maybe there's something in this class 4. When I took on the class 4, that's when I started to really, really get good results for fertility. It just seemed like, yeah, and it makes sense. It's a very, very good device. The way in which it's programmed, it alternates, it goes through cycles, it changes pulse rates, you adjust it depending on the type of the area of the body that you're using it for. So it's not just, we're just throwing a whole heap of dose at this, and one size fits all. Not at all. It's a really nice piece of equipment. It's a K laser, but there are other versions of it around. And then I have a larger panel, which was the panel that was really made famous for fertility, because it's the PowerMedic gigalaser system. That throws out a lot of energy, but I don't just rely on that. I also use the class 4 in the treatment as well, for all the reasons that we've talked about, the multi-wavelength, but also the classic way of being taught low-level laser was that you should put the light directly onto the skin. The skin absorbs the light through the skin, you know, so for a cold laser, you would put it directly on the skin. The class 4, obviously, there's a little bit of a gap. You're also moving it. So I think there's something about how do you get the widest, deepest penetration of light into all of the different tissue at the power level that you want it to be at. I mean, the gigalaser delivers like 20,000 joules. 20,000 joules come out of the panel. I don't know how many of those 20,000 joules are absorbed. I'm talking about a 14,000, 13,500 joules dose in this particular protocol that seems to be the winning protocol. In many cases, this seems to be the winning protocol. But where do I put it? So obviously we want to target directly over the ovaries, the uterus, the reproductive system. And I would say I spend the greater amount of time over that area. But there's also a way of getting the light in through the sacrum into the back of the uterus. The uterus sits behind the sacrum, right at the base. And there's some holes here. And people's ovaries actually often fly around the back. So if they have, and I don't do anything. I don't use a guided ultrasound while I'm giving the treatment. So we just want as much tissue to be absorbed, to absorb the light as possible. So I go in that way as well. What I also do is I treat the lymph nodes, because that's where our white blood cells are made, and I want to really improve the functionality of the lymphatic of our immune system. Basically, immune system's everything. Clears away all the rubbish, and it, you know, strengthens our entire system. And then I put into the light through the back of the neck, because the vagus nerve runs through the back of the neck, the upper cervical spine. It's close to the brain, the command center. There's the thyroid gland sensors are around the back there. So, and obviously, thyroid gland is still involved in the endocrine system as much as the sex hormones. So, it's kind of like it's a holistic approach.
Yeah.
Somebody came to see me today. She thought she might possibly be pregnant. So we do all of those areas without going over the abdominal area. Not that I don't think there will probably be any harm to put light over the abdominal area, but we don't know, so we just don't.
Yeah.
And plus the fact we don't want to make babies so big they can't get out.
Well, yeah, and I remember. I think in your the last paper that you published with the case study, I think you did have someone who used the laser
Yeah,
in their first 6 weeks. So it's
six weeks, 6 to 12 of the first trimester. Once she knew she was pregnant, she'd been on such a long journey. She'd had so many failures. She was just like, I don't even want to tell anybody about this. I mean, her husband knew, I knew, the doctors. She did. There's no point in telling doctors. They're not going to do anything at this stage. Let's just get me let's get me through the first trimester. And so I said, well, I feel like I want to keep giving you a bit of energy throughout that process. So yeah, for once a week between weeks 6 and 12, she came, and we just put the light into these key areas. Forget it's going to attach to blood, and we're going to get that kind of general mitochondrial uplift through the system
yeah.
as a result. And, just going and sitting in the sunrise and the sunset could have just, I mean, like, but do that as well, right? Like,
Yeah, absolutely.
bombard yourself with as much good light and, good food and sleep and all the things that we know increases our mitochondrial energy. Just do it at will,
Yeah.
yeah.
Yeah, I've because I use these points as well. But one thing that I've just started adding is just based on that recent paper that came out on sepsis. So they're looking at significant improvements in the immune system and things. So I'm doing the lymphs as well, but I thought just on the radial pulse,
Yeah.
using the light there, and then I also go do a little work on the hip bones as well, the hip bones and the tibia, because they're great sources of stem cells. And I thought because every
That's really
IVF
interesting.
clinic is trying to sell you on PRP and all these invasive. I'm like, okay, there's been some really interesting. Now it is experimental, and they're most of these, especially around the stem cells, they haven't been replicated in large studies yet. But
Yeah.
it doesn't do any harm, and I figure it's going to add a minute or two extra to the treatment, and like get our
Yeah.
get our own stem cells that are going to support the reproductive system.
I'm going to try that. So that sounds good.
Yeah, and again, it's not difficult.
Not
Um,
difficult.
so then, when we talk about again, you mentioned a little bit about the skin contact. So that's what I've seen as well. And as you know, I write protocols for women who have bought maybe a panel at home, and I'll kind of go through it whether they're likely to get any kind of therapeutic dose
Yeah.
from a
Yeah.
panel or a torch or whatever they have at home. And without, and I know I'm like a broken record, but the evidence is fairly clear. If you
Yeah.
don't have skin contact, especially skin contact that is going to displace blood and tissue, like I have a laser that I use kind of as a maintenance laser that my clients go home with to use, and it's one of the most powerful 3B lasers you can get here in the US. But when I'm telling them how to use it, I'm not saying, oh, you're just going to gently rub this over kind of the ovaries, and I give them the landmarks of where they're going to use it. I'm like, you're like, it's firm pressure. We want to displace as much of that
Yeah.
fluid,
Yeah.
blood, water,
Yeah.
and tissue and
Yeah.
get as close to the ovaries as you can. So it's like
Yeah.
it's firm
Yeah.
pressure into
Yeah.
those
Yeah.
areas. So it
Yeah.
is tricky
Yeah.
when. So do you find you come across women who have already been, I guess, trying to replicate the laser results at home with panels and
Yeah, I think so. I think people feel that they've already been doing this, but what they mean is that they've kind of bought some kind of quite relatively low cost device. Um, I mean, a lot of the manufacturers, they took studies which were
yeah,
using 3B and 4 laser. They just took those papers as evidence that this PBM works for fertility, but they attached it to something which wasn't really the same. It was
yeah,
a red light device that was probably loaded with 600 wavelengths, probably has a few 800 wavelength in there as well, but they're all LED. They're not laser. And LED, the way that LED works is it scatters.
yeah,
So great for skin because it scatters. Um, but it's not going to be absorbed into the tissue by, like you say, pressing on it. So
Yeah.
there's a device, I think, that everybody was being kind of like steered towards called a Soluma Pro, which I had a look at, and it looks like that's probably, I mean, it's more expensive actually. I think it retails over here at like 2,200.
Yeah.
And it's like a kind of like a thing that kind of sits over like a dome, would be a dome or something anyway, but it sits away from the skin. And for giving you that really, really healthy glow, it would literally be like going and sitting and absorbing the sun at sunset. And you know how that's the best time of day to take a photograph. I mean, there's no one that doesn't look beautiful in that kind of light. I mean,
Yeah.
it's just like the best. So I don't doubt its ability to really, really help with skin health. But I don't personally see how that is going to, if you were to put that over the abdomen area, I don't really see how, plus the fact there's only a few 800s in there anyway. I don't really see how that's going to give us the kind of penetration, especially when I know that it will deliver in a, say, 30-minute cycle. Those kind of devices, I think they deliver probably about 150 joules, or the power is like 150 milliwatts or whatever.
It's
And
not even. It's because I.
it's not even that, is it? It's like 30. Is it like 30 joules per centimeter squared or something like that?
Yeah,
It's like,
and they're quite because I've spoken to some of their reps who are quite keen for me to purchase one, and I'm like, because a lot of acupuncturists have been, I guess this company
yeah,
talking to acupuncturists, telling them this is red light therapy, and then acupuncturists are investing in this device and becoming a reseller for it. But I'm like, and there's a bit of blue in there as well.
yeah,
So
there
yeah,
is blue in the Salumi. Yeah, there is, which is
yeah.
great for acne. It's great for acne,
There's it
Yeah.
definitely, but they're another company that has looked at, taken the laser research and just said, oh yeah, that's, this, our device works as well.
Yeah.
But there's a,
In theory.
yeah, there's another device manufacturer that is just about to come out. I think they're either coming out, or they have another device they're suggesting will be really helpful for endometriosis. This, and they're using lasers. So I think they're starting to realize that the LEDs are not going to have the same impact on fertility. And now they're kind of looking at laser. But this particular device emits as much laser as a supermarket scanner
Oh my God.
for endometriosis, and PCOS. They're claiming this is going to help. So I'm thinking,
Yeah. And it's not,
no,
yeah, it's kind of confusing the market, but it's also, it's going to set false expectations.
yeah,
And then the really good stuff, and I mean, it's like, look, I mean, we know what it is to invest in really, really good equipment. And it does look expensive, mind you say, it does look expensive in the light of some of these kind of devices that you can buy on Amazon and, across the
yeah,
internet and stuff like that. But there's a reason for that, right? There's a reason why,
yeah,
the £20,000, 30, what's that? It's $30,000. Yeah, I mean, there's a reason. The way in which they've been manufactured, the way in which the light diodes have been configured, yeah, they are designed to deliver really, really deep light in a decent, optimal kind of dose. So listen, if there's anybody listening to this that's going, look, I just bought my red light man device, I used it for a month and I fell pregnant after 3 years of failing, I want to hear it. Like, do you know what I mean? Like, if they really are successful, great. I'm great. I
yeah.
just haven't been aware of it.
Yeah, and
And I'd be,
I actually I have because because I see that as well. Somebody in some of the groups will say I'm pregnant, and everyone's thrilled, because especially like
yeah,
you and I, who've been in the fertility business for a while. We're like, oh, I don't
yeah.
care
Who
what
cares?
happens.
Yeah, we
It
just want
works,
babies. We just want babies. We don't care.
Yeah.
Yeah.
But it's like, but I just put a blog out this week about, okay, so we want to understand what are some of the confounding factors that could have,
Yeah.
was it the red light, or was it, the fact that you started new supplements, or you started to get daylight, or you're supporting your melatonin at night and you're,
Yeah.
you're blocking all
Yeah.
these screens.
Yeah. Yeah.
I think it's so important for women, if you are considering red light therapy for fertility, that you start with a baseline, find out, like get your labs. And if you're not working with a clinic and you're working with a reproductive restorative team, get a baseline of labs, and then, if you're cycle tracking, like tracking your cycles, your mucus, all of that good stuff, your temperature, track it for 3 months. We should be seeing a change within 3 months. We should, even if it's subtle.
Yeah, yeah,
If you're not seeing
yeah,
change in 3 months,
yeah,
either you're a
yeah,
non-responder, which is
yeah,
not out of the realm of possibility. There's a low number of women that won't respond, or how you're using the device is not, or the device is
yeah,
just not suitable. Because
yeah,
red light
yeah,
man in particular comes with a huge amount of heat. And they want it, what I think is interesting is they
yeah,
want to be a laser because they keep packing more lights into it, but yet they say it
right.
works as effective as a laser. But they're LEDs, and I think now they put a fan into it so it doesn't overheat. But how can you determine what a therapeutic dosage is if you're just doing this and
Mm,
you're waving some hot device over your neck and your
yeah,
ovaries for
yeah,
5 minutes? It's a
yeah, yeah,
non-thermal
yeah,
product. It's a non-thermal
yeah.
therapy.
Yeah, I love that abdominal device that they've. It's a doctor actually who's designed a scientific doctor in South Korea, and he designed it. And it is an ingenious device. He's designed one for breasts as well. Um, but the what I love about it is that there's 550 light diodes. Obviously, it is LED power because it's a home use device. You can't start sending 3B lasers out into the environment because they will damage eyes. Um, but it sits close against the skin, flat against the skin, um, and it's got enough lights and then they kind of pulse them, and it's just a clever device. And you kind of go, because I'm aware of the cost element, and I'm also aware of geographical restraints as well. So I wanted to be able to say, yeah, this would be a home use device that could actually make a difference. So I had a lady came in recently. Now she's at the other end, so she's kind of almost getting menopause, or she hadn't had a period for 6 months before she came in. We did 5 sessions in the clinic, and she took one of these devices and used it every day. Her periods come back. Her FSH has dropped from 80 down to 30. And now she's in a position where she can start to work. She didn't do the PRP yet, so she was leaving that a little bit. And now she's in a position where she started to get levels where they could start to do some IVF. I think she'd had some kind of like premature menopause or whatever, like she's not that old, she's still early 40s, but that was the situation. So I'm kind of like, I wonder if the home use device helped. It's that regular, because I think there's something very much to be said for regular dose of light. Like if you can get a daily dose of this light, um, that's got to be better than just relying on clinic sessions.
Yes.
So I'm really, yeah, I'm kind of quite, there's a few other people that, you know, yeah, I've got them out there as well, and I can start to really monitor that. But I have a feeling that the home use device really helped support her outcomes there. But
Yeah. And
let's
then we're after
see.
seeing, there was I think a paper's after coming out the last couple of weeks looking at this new, well, I don't think it's new, but it's in UCSF, we're looking at the fact that there's this whole ecosystem around the egg, that it's not just, fluid, and that there's sympathetic nerves. So it's like, so we know the stress response is going to play a part in this, of course, inflammation. And they're looking at, is there a way that we can support women's ovaries? Now, they're kind of leaning towards HRT, but can we support the ovaries for longevity? Because it affects like every system in the body. So I'm like,
Yeah,
okay, maybe if we were, I think we might see further down the line where working with this just for fertility, we're going to see that women are feeling better in later in
yeah,
life as well, if they're
yeah,
using the light consistently. And
yeah,
just thing, I think it was a couple of months ago, I wasn't feeling great, and I went over to the clinic, and I'm like, I'm just going to do some red light, on my
yeah,
abdomen, for microbiome support. And so I did a little bit, and I'm postmenopausal. I had early menopause. I'm on HRT, And so I had like 2 days where I went back the next day and I kind of, it did the laser again. Day three, I started
Did bleed.
spotting. I started
Yeah, I've had
spotting.
that.
No, no more laser over my abdomen for me. Keep it well north of the ovaries, It's like, yeah, I thought
Yeah.
that was like, because I was thinking of the Oshiro trial, because that was how he
Yeah.
kind of realized it was like this women were coming for back pain, and by treating for back pain, these women who were postmenopausal were getting their periods back. So I'm like, no
Yeah.
thanks.
Yeah. It stirs something up for sure. It definitely, and if I'm feeling low on energy, I actually just give myself the fertility treatment because I would argue that well, if a menopausal woman came in, it's the same treatment I would give. So, I've always got more energy on my yoga mat the next morning. It's quite profound.
Yeah,
I can't rely on giving myself a laser treatment every day in order to be able to kind of like keep doing my yoga, but
yeah,
there's definitely a highly therapeutic dose of light that you can give into the abdomen. Yeah, digestive tract. I just think there's just so much tissue in the abdominal area that can absorb the light. And then, of course,
yeah.
it goes on its journey and it just helps process so many other things in the body at the same time. I love the fact it can't do any harm. It's just one of those things that it's just going to help.
Yeah.
And if these red light devices at home use make people feel better, great. That's part of it as well, isn't it? And reduce pain, increase feeling of well-being. I have no doubt that those panels can't do that, and that's also going to inform, isn't it, a successful conception. So, yeah,
Yeah, I'm excited for where this whole industry is going and the science is going. It
yeah,
just there's yeah, and especially like what they're using now on. 'Cause also use it on the brain as well for
yeah,
fertility. And there was a new paper out just last week, and I thought, oh, this is and I already have people like friends and family literally lining up for me to treat them for chronic insomnia. And they're just using a 3B laser just over a couple of points on the forehead, 5 minutes. So I'm
mm,
like, over a 3 day period, I'm like, okay,
mm,
that's
mm,
doable, and if that's going to help people sleep better. So I
yeah,
have a couple of people that are just like,
yeah.
I'll sign any piece of paper you want, just let me see if this will help my insomnia. So and it's very easy, and
That's really interesting.
they'll
Yeah,
be able to do
that's
it at
really
home
interesting.
themselves. And I
Yeah,
think it was 808 nanometer, and
808. Yeah.
yeah, yeah.
For great
So,
wavelengths. I think as well, the one thing I would say is that, there's a lot of people getting into the industry. They're doing stuff in labs, they're doing stuff with the equipment, but I really, really do believe it's practiced in the clinic. Every single patient that comes in, you learn something new. Every single situation is slightly different. I think if you are coming from a therapeutic background where you appreciate that everybody's different and that you want to work with whoever's in front of you and really adapt the use of this light to that particular individual, that I think is where we're really going to gain the most experience and wisdom,
yeah,
to be able to really develop things. Because I think, sometimes you see people come in and you almost get the feeling they're like, A, I need to do this because it looks like there's loads of money in it now because everybody wants it, or something like that. And then B, just tell me what the dose is, or just tell me what the equipment is. Like, just tell me like where to put the equipment and how long to put it there for. And it's like, it's not quite like that. When you've worked with so many different people, you almost like the minute they walk in the room, you can kind of go, you're starting to put your protocol together,
hmm,
in terms of what's going to be the best approach for them, because you
yeah,
can very quickly start to get a sense of how well they're metabolizing energy, full stop. You know, it just,
yeah.
you
No,
just can.
I agree completely. There is, I think yeah, we're definitely seeing an increase in, and an increase in, and I think if you're already in the wellness industry, I think people think, oh, it's fertility, it's just another problem. We just throw a bit of light on it, and then, but I'm also going to use it for shoulders or whatever else, you know. But I think, you know, having, you know, experienced, you know, primary and secondary fertility challenges myself, I want somebody to talk to. I don't want to be just put in a room and put under a
Yeah,
laser, or
yeah,
somebody's just going to do, you know, because they bought a laser and they're going to use this wavelength, but they haven't got that experience of working with and understanding women's cycles. And even
yeah,
like I had someone recently that was asking about starting their own laser business, and they had no understanding that your Fitzpatrick skin type will affect what wavelengths you're going to use. So I'm like,
mm,
and that worries me
yeah,
because if somebody comes in who's very dark skinned, very melanated, and you throw in I'm not even going to talk about what the wavelengths because I don't want them going out and harming people, but it's like they need
yeah,
to go get some training.
yeah,
Go learn everything you can about how the
yeah,
body absorbs light and the
yeah,
different wavelengths. And
yeah,
there's tons of information out there, but you have
yeah,
to spend the time to
yeah.
educate yourself and
Yeah,
get
yeah,
that
you really
experience.
do. You really do. I mean, when you kind of see, well, I mean, obviously, you know Reem as well, and you know, she approaches it as every good surgeon should, as a absolute, you know, medical researcher. And, you know, it's not that simple. You know, there's a lot going on here. If it was just a case of, oh, you know, we all want to just go and lie underneath a, you know, a PBM bed or whatever, you know, that you've got at the gym, I just, you know, this is photobiomodulation when it's done, you know, in its most kind of advanced way is about very, very specific doses of light into very specific tissue in all sorts of different situations. And it takes a long time as a practitioner to really appreciate that. And it comes with working with different people in different scenarios over a period of time. So,
Yeah.
yeah, just think it's important we remember that.
Yeah. Ruth, thank you so much for
Pleasure.
being so generous with your time and expertise.
Not at all.
Um, I look forward to your next paper. Are you working on anything new?
Oh, just kind of really doing a lot of work in neuro work and, you know, this whole kind of Parkinson's area, I think is really interesting.
Yeah.
Also doing a lot of work with children, the ADHD. Again, this anti-inflammatory effect of light is so powerful in just calming inflammation down so that tissue can start to grow properly and behave properly. So I think that might be my next challenge, but let's see.
Well, we look forward to reading your next publication. So for
Well,
anyone who
likewise.
is, yeah, I'm going to be updating that book this week. Tell us where people can find you.
I'm at lasermedicine.co.uk. Lasermedicine.co.uk, and there's a little shop there now as well. So, yeah, hopefully choosing some of the best devices for home use. And we're in London. I've got a couple of clinics in the UK that I travel out to once a month as well. So, yeah, that's where I
Great.
am.
Ruth, thank you so much. And I'm sure we will talk again soon.
Definitely.
All right, take care, Ruth. Thanks.
Thank you.